Welcome back to another episode from the Optimal Body Podcast. I'm Doc Jen.
And I'm Dr. Dom.
And today we're talking about QL pain, that side of the low back, kind of above that hip, where that kind of gets a little achy. What is it? Why is it happening? Let's talk about it.
Diving into another PT Pearl on the QL, or the quadratus lumborum. And here we go. Let's dissect another fancy medical term. Quadratus, square, lumborum, low back. It's a square in the low back that is actually integrated in a lot of different types of movements, types of processes. It's not like the primary mover for any of them.
Right.
But a lot of the times it gets blamed for why people might be having this low back pain.
Totally. And that's what people come in. Like, that's what they've been told. Oh, it's your QL. Your QL is tight. You got to release your QL. So how do I stretch it? How do I release it? How do I do my trigger points on it? You know? And so we really want to break down why that all might not be as effective and what else you can do to actually help to start integrating back into this movement pattern and hopefully feel better. I mean, ultimately, if we're just thinking about where it is literally on the side of your body, connecting from the top of that hip. So it's called your iliac crest. So the top of your hip, and then feel the top of your rib cage, and then back into the lumbar spine, your low back. And it's just, if you put your hand right at the side of your waist, you're covering your QL. If you're sitting and you lift your hip bone up, you can kind of like feel it activate.
A lot of different movements, a lot of different things that the QL is involved in, and we're going to kind of dice through some of those.
Right. And it's interesting because it's like when we talk about the low core, we don't even address the QL at all. Because if we're talking about like the inner box of your core, we usually talk about the diaphragm, the pelvic floor, the transverse abdominis, and the multifidi. But the lumbar, or the QL, is kind of combined in that a little bit more externally, maybe not as inner, but it's going to help with the expansion of your ribs. It's connecting into our diaphragm. So there's parts of the diaphragm, that lateral, what is it?
Arcuate, the lateral arcuate ligament.
That's connecting into the QL as well. And so it is connected with that inner core then. Yeah.
So anytime that muscles that are connected to the QL or connected through fascial planes, like our thoracolumbar fascia, which is one of the thickest, densest fascias in our body. Thoracolumbar is the one that kind of runs from our thorax to our lumbar spine. So many of our back muscles on our shoulder blade, muscles in our hips, all connect into that. Our transverse abdominis connects into that in the back. And the QL kind of like lies right in tandem with that thoracolumbar fascia. So anything that pulls on that fascia is also going to give a pull to the QL. Yep. And generally, our muscles, when they get pulled against, are going to want to pull back or tighten to resist that to some degree, right? Because we talk about balance, like really the system just has to work together in synergy with itself. If something around the shoulder blade or something around that upper back is getting tight and pulled, well, then that's probably going to have an effect lower down on the chain. It's like those tensegrity models or whatever. If anyone knows what we're talking about, Google a tensegrity model, or even when we talk about extension or side bending of the low back, a lot of people will say that the QL is involved in that. The research that we looked into said only about 10% of those motions, or 10% of the force, was produced by the quadratus lumborum, where a lot more of it was produced through our multifidi, our erector spinae, and other back muscles. So your QL isn't the muscle that's just like holding you into that side bent position and causing all the pain. Well, no, there's other huge, big muscles that are at play there. And so if you're feeling like, your QL is doing all the work, well, then are we eliciting these other muscles? Are we, talking to the entire picture? And so I think we get to not just focus so much. And the other thing the QL helps with, it's just an accessory muscle in terms of breathing. So when we take a deep, really
big inhale, so inspiration, if I take a really big inhale, hopefully we've taught you in episode 11 of the Optimal Body Podcast. We mentioned this one so much. If you haven't listened to this one yet, go listen to it. But we talk about wrapping that low rib cage, right? And then taking a deep inhale. And if we really focus on a forced inhale, then we're going to have to use accessory muscles to kind of help and expand that low rib cage. And so the diaphragm helps in that as well.
How do you know if you're having QL pain?
I mean, a lot of people will experience like a deep ache or a pain, and they'll kind of point toward that low back. I mean, right where you kind of put that hand, right? Around that waist, low back area, and you hold, and it's kind of pinpointed on one side, a little bit higher. It's not like as low as the tailbone or SI area. It's a little bit higher in the back, and that's those deep aches and pains that kind of people experience. Yeah,
a lot of the times to like distinguish it between SI pain, which we did an episode not too long ago on, a lot of people with SI pain will point like one finger at the spot, where I feel like people with QL pain will kind of take that hand and put it backwards on their back like you were just doing and be like, this is kind of where I feel it. And a lot of the times what they blame is these trigger points in the QL that kind of cause these referral patterns. Like anytime we have taut or tight bands of muscle, especially in the QL, there's lots of nerves that are running in our deep low back.
Also pain or achiness kind of first thing in the morning. So like depending on like your sleeping position, then you just roll over and kind of sit up and you're like, oh, that kind of dull ache is still kind of there in that QL area.
Yeah. And a lot of that's because, when we get in this sitting position and we just kind of relax into different ligaments, or we're not, actually actively controlling in our core. That's where we like to talk about different active sitting positions you can use at work. As soon as we go to change direction and then we suddenly need to activate in that core, our body likes to find safety by locking into, or those muscles kind of grab into a spasm of sorts to find safety. So then when we identify, okay, I'm having some trigger points, or I'm having some pain in this QL, like now what? How can I treat this?
Yeah. And so unfortunately a lot of the research is going to be very pinpointed on that direct area. So if you're having QL pain, we can do trigger point release right for that QL. We could do trigger point injections right for that QL. We could do some osteopathic techniques, which aren't bad. I mean, they do get certain things to kind of move and hold and breathe in different positions, but ultimately, what is that all doing? And that's where Dom and I, right? We're going to go and look at the bigger picture, and you probably already heard some buzz terms as to where this QL connects to, that hopefully after you've been listening to us enough, you're like starting to pick this up on your own of like, oh, well, it connects into the rib cage. Oh, it has an effect on the diaphragm. Oh, it connects into that low back and core area. I wonder what could help.
Diaphragm, breath. Again, even just sitting doing these podcasts, a lot of the time I get, so amped up that I can tell myself I'm getting more into my upper rib cage. My shoulders are coming up towards my ear. When I'm breathing into my upper rib cage, again, my lower rib cage isn't moving as much. Therefore, my QL probably isn't involved in that as much and might be kind of holding down and getting into this tighter position because it's not moving and it's not as dynamic with my breath. So even just taking a few of those deep breaths into the rib cage.
Yeah, feel that low rib cage. Breathe into it.
It's going to do a lot of things. It's going to get our QL activating through more of its range. And also it's going to get our parasympathetic system activating, which is just going to decrease the tension and stress overall in our body.
When we're just pinpointing the QL and saying, this is where my pain is, punch into that pain, let me release it, what do you think is going to happen? If say you touched it enough that it relaxed the tissue, because that's what we know trigger points are really doing.
Broke up some fascia?
Not really. So if we know that if it touched the area enough to elicit change, what happens when you get off that table and you start moving again?
It stays like that forever.
It does?
Ever? No. If you don't change the way you do stuff, if you don't change the way you move, you're not going to get a different result. And that's one thing we like to preach a lot of the times. Like, you can go in to a physio, to a chiro as much as you want, have them rub out all the knots in your QL, have them work on your thoracolumbar or thoracolumbar fascia, potato.
Even
I don't
do some
care.
ART. Maybe you were like, but I'm moving with it, right? I'm activating and then relaxing as they're doing those trigger points. I'm doing work.
And then I go back to work and sit for 8 hours again. You need to, again, do something different to get a change. So if we're only using those passive modalities and we're not assessing up and down the chain, we're not assessing kind of how we move throughout the day, we probably won't get a different result.
Exactly. So just think about how we're using this. If you need to calm down the symptoms because you're like, listen, I can't function in my everyday life. Okay, cool. Like maybe you're getting some passive treatments and that's going to help you for that short term. Like you have to realize that these methods are temporary.
Grab a foam roller and set it by your desk and like have something by your desk, like the IntelliRoll or like yoga tune-up balls that you could put behind you in your chair and kind of like actively work into those a little bit. And then take 5 minutes, like we always say, take 5 minutes every hour to get on the ground, do some mobility, do some thoracic rotation, stuff like that.
Yeah, exactly. Because again, it connects along that thoracolumbar fascia, right? So think of that whole upper back area needs to move more then. So if you're going to lay on a foam roller, which by the way, the IntelliRoll is the perfect foam roller for the QL. Like literally the way that it is indented will get you into that QL. But once you do that, then we got to stimulate some change. So then we're going to open up the upper back. We're just like Dom said, we're going to do some active mobility, and you don't even have to do the open book laying on the ground. You could do it sitting at your desk. You could just rotate. Literally, I'm just going to sit in my chair and take some time to rotate. I'm going to take some time to put my hands on my rib cage and take some slow, intentional, big breaths. I'm going to take some time to just think about opening up into that upper back. Like there's so many different ways that we can do it, even just sitting and changing the way that we feel.
I should seriously just do this like every time you're talking while we're doing podcasts, because I feel so much better if I just like rotate 5-6 times, especially when we're like recording for 5-6 hours a day.
Exactly.
Like feels so good in your body. And I mean, you mentioned the IntelliRoll, the contour zones of the body. It is like the big spoon that was built for your hips and your low back.
For your QL. Code DocJen, you can get your little discount using that one.
Oh yeah, we'll tag those things up for you. So
there are specific techniques that you can do for like kind of those nerve entrapments that you're feeling. And I've shown this before, but it's kind of like think of you're doing a hip flexor stretch. So you're in that low lunge position. And then you kind of wrap your arms around your head, because then I'm bringing my upper body or my arms up, and then I'm creating some pressure and some tension away from that area where the nerves come through in that kind of upper back, low back region, that thoracolumbar region. And then you might do some, like if you were going to stretch into that QL or into that hip flexor, we usually side bend, we do some rotation. But now if I bend my head, I actually put that nervous system on tension. And so I help to get into that area even more.
Yeah. My favorite thing about this episode so far is we've gone through the whole QL episode without even mentioning the QL stretch, which is like the first place that everybody goes. It's like, oh, just get against a wall and do a QL stretch. Like, again, great. You can maybe put some tension through stretching into that QL and get it to feel something different. But then if we go back and sit or do what we were just doing that kind of elicited that pain, it might not change.
Exactly. And honestly, my favorite QL stretch is that side bending one. I even have a gif of it because it feels so yummy. Just along that entire area, though. It's not even like, I think of it like a lateral line stretch all the way from my hands all the way down to my legs. It just feels so good.
You're familiar with the anatomy trains, the whole lateral line, just finding a way to put that whole thing on tension, because then you'll realize, oh, wow, I got a few different places along this lateral line that I need to give more attention to. It's not just that QL. Core stabilization is going to be huge. Specifically once I started doing a lot of Jen's optimal body workouts, like Core 1, my absolute favorite, because it teaches me how to coordinate my core. Some of the muscles that we were talking about earlier with the pelvic floor, the transverse abdominis, the diaphragm, just learning how to breathe well with those. Again, putting pressure around that low rib cage, maybe with a band. It really kind of teaches your body to do that. And if you use the band, you're actually doing it against some resistance, which is really cool. But the QL is going to be very integrated with that. So if we're teaching that integration of our breath work with how all those different muscles are pumping, the QL is also going to start to tune into that.
So if you're having QL pain, like you want to learn core work, it's not just about abs. It's not like your six pack. When we're talking core work, we're talking coming back to those foundational pieces of how your body actually works together as a pillar so that you can stabilize in all these different positions.
Yeah, the six pack is way overblown. Literally, like I've had a six pack since I was like 15 years old, but I've also had issues with inguinal hernias, issues with my pelvic floor not, working quite correctly or being way too tight for myself. So it is about the whole core. I'd give up my six pack any day if I could just have a core that would consistently work in integration with itself for me.
We got to move, we got to strengthen, we got to learn our body, create different patterns, breathe well, breathe often, obviously, because we're living.
So there we go. Everything about the QL, how to get rid of some of those naggy, achy pains in the low back. Comment below. Let us know what you loved. Let us know what you want to learn. Subscribe, and we'll see you next time.